That's not quality of life. So when the close family member gets anxious and stressed and frustrated, that can fuel the fire even more, because of course that gets felt by the patient, the individual with the IBS. Because remember, any stress is enough to sometimes exacerbate the IBS symptoms in most patients. So we try to emphasize the importance to the immediate family member, spouses and kids, to downplay rather than upplay the stress of the general picture. Once the diagnosis has been made, if under the care of a physician who's addressing and treating the IBS symptoms appropriately with repeat visits, the best that person can do, then when somebody does have an attack of IBS, or they do suffer with a moment of the belly's hurting and they get an episode of diarrhea, downplaying that rather than upplaying that has actually more of a beneficial effect. Because putting less emphasis on every episode of abdominal pain by being reassuring to that loved one, honey, it's just IBS. It's acting up a little bit, you had a stressful day, we're going to work through this together. Why don't you lie down? I'll get you a little heating pad, put you in a quiet room, and we'll try to hopefully this will pass. I'll get you your medicine. You may need an extra dose of your antispasmodic. We're going to get through this. It's just that IBS. And everything's going to be all right. That's so important. Because, again, the family members play a big role in what happens to helping to calm their loved one with IBS. And that's very important. I can't tell you how many times my patients describe a severe attack of abdominal pain that brought them to the emergency room because they fell down on their knees, lying in the embryo position, grabbing their bellies in severe pain, feeling like it's the end of the world, the big one's coming. And some of these patients, again, end up in the hospital, emergency room. They're retested because this was a severe episode, what could be going on, examined, and after another significant medical workup, they're left with, frequently, the doctor saying it was an episode or an attack of irritable bowel syndrome. And this is a common problem also is the seeking to eliminate the pain of IBS with narcotics. And it's only natural to want to take away the pain as soon as possible, immediate removal of the pain. I tell all of my patients that narcotics do not have a role in the routine treatment of chronic pain, chronic IBS pain, and I do not prescribe them. Remember, IBS is not a disease. It has no effect on longevity. However, getting addicted to the frequent use of narcotics can become a serious medical problem and can cause often serious medical issues, dependency, withdrawal, and other side effects. So management of the pain from IBS with narcotics is definitely not recommended. There is an exception to this, however, and that is it's not uncommon for a patient with an established diagnosis of IBS who does have a severe attack, sending them to the emergency room, where that pain is so severe, but the pattern, the location, and the quality is so suggestive that it's an IBS picture, and all of the ER evaluation, blood tests, workup, x-rays are normal, that those patients will frequently benefit from a dose of Demerol or morphine in the emergency room to break the attack. And this happens frequently. And then after that, after the attack is broken with a dose of narcotics in the emergency room, the patient usually can go home and they're back on their baseline, back to baseline symptoms and baseline medications, and symptoms again are hopefully manageable at home and with their medicines and lifestyle modifications. Another scenario that I sometimes see is the occasional IBS patient who, after undergoing colonoscopy, develop more severe IBS symptoms or more severe symptoms of IBS. And this can last for hours or days. And in some cases, people might say, ever since my colonoscopy, I had this pain, and colonoscopy was normal, and you didn't see anything during the colonoscopy, but they're presenting with pain. In the case of irritable, in quotes, bowel syndrome, when you instrument the colon with the colonoscope, frequently you make the colon a little bit more irritable, especially when that colon may be more redundant, difficult to get around. You had to apply abdominal pressure. It was a more difficult colonoscopy to perform. Sometimes you're going to be, just from instrumenting the colon, make it more irritable. And in that situation, people will think that something terrible happened when in fact it's just an exacerbation of some IBS symptoms that used to maybe be low level or almost non-significant and suddenly flared up because of just the instrumentation. Most of these people will be fine and require only minimal therapeutic intervention with medicines. Sometimes it'll just go away by its own, but that's what we sometimes see as well. Another common scenario that we hear from our patients is that when they're doing the dishes in the kitchen, that when they're leaning up against the sink doing the dishes, they actually feel tenderness, soreness on the abdomen, because the intestine, remember, is hypersensitive due to the nature of what IBS is. And so as they're putting pressure on against the sink doing the dishes, they'll describe that it's uncomfortable, it's tender, it's sore. And again, that's IBS.